report by the San Diego Workforce Partnership estimated this region will be short more than 18,000 mental health care workers in the next 5 years. The county's plan calls for creating a $128 million fund to create a worker pipeline to fill the void.
We spend hundreds of millions of dollars propping up a broken system.
Since we first spoke to County Board of Supervisors Chair Nathan Fletcher about the devastating impacts of the mental health care crisis in our community, the board has implemented changes on several other fronts as well.
And you know, our county, every year I've been here, has made historic investments in behavioral health, higher than we've ever made before. But it's not the dollar amounts. We see it now. Mobile crisis response teams countywide, which means that individual who's not a danger to themselves or someone else, now we have a trained clinician who goes, and they're matched with the peer support specialist. A peer support specialist is someone who's been through mental health and addiction issues. And they're really powerful when they can talk to that individual and say, hey, I've been where you are. It gets better. 3, 2, 1.
The county also now has 7 crisis stabilization units, with more in the works, including this one in Oceanside that opened this past April. The walk-in facility is open 24 hours a day, 7 days a week.
And so what crisis stabilization units do is it gives us 24 hours to really stabilize and say, hey, what's going on with this individual? Maybe they need detox. Maybe they need psychiatric help, you know, whatever it is. But out of the people who go to our crisis stabilization units, 95% of them do not have to go on to another higher level care. They're able to deal with it, get you treatment, get you help, and then begin that ongoing case management.
When I first started really researching this kind of mental health care crisis in our county, we heard a lot about how there had to be this fundamental change in how this system runs.
Yep.
Basically turning it upside down.
100%.
Do you think that we're close to doing that, on the way to doing it at least?
We're getting there. We're getting there.
Supervisor Fletcher says that huge societal change is still going to take more time and more work.
We've got to quit putting the stigma on it that we put on it.
Don't you feel like that's getting better, though?
It's getting better. I do think it is getting better. I think it's getting better, particularly with the younger generation. I think it's beginning to transform. But, you know, Catherine, the real dream is that one day we don't talk about behavioral health, mental health, and addiction. We don't talk about it as a separate thing. We talk about it as health.